See how everyone's doing. Got a bit of vapor rub. It's not as strong as it used to be. Yeah, this is not the Vicks though. This is just like a cheap alternative. So the Vicks one should be a lot stronger. But I'm gonna put this on at night. I'm just gonna put a bit on my near my neck. I'm gonna put a little bit under near my nose. My dad used to actually stick this in his nose. Now I know you can get them little nose sticks that you'll breathe in. But really, what we need to do is try and open the airwaves that much that we sleep better, because we're not compensating our breathing with our lung condition or our nasal condition. So yeah, they used to use that a lot. I remember it when I was a child. My mum used to give that a hell of a lot, and it used to help your cough as well. It was that strong, it used to actually act as like some kind of mucus thinner by making you cough. But anyway, I'm only on here because I did say when I'm on treatment, I'll show you that I'm on treatment so you can see. I've got the needle in the chest. I've got the long wire. Now, I did speak about this today, and I said I'm glad they've made these a bit longer. So all that is, it's just like your line to your port, and they get access through this. It's not a green skittle, it's actually a cap, and it's on the end of this valve that you can see. A few years ago, what they used to do is just wrap a piece of like tissue or gauze and protect it. So I'll take it off so you can see. So basically, nothing can really get inside that anyway. For it to get inside, it needs something that's actually attached to it. Whether that pushes that blue bung, I don't know, but that's how they connect the IV drip. So they installed this, which is pretty good because it's fully airtight and it's shut on the valve. We'll call it a check valve. I don't know what the name is, but we'll call it a check valve. And they do have some difficulty getting these on. Sometimes they screw them on and you can't really get it on because it goes like that, or they push it down. So I'm going to try the push method, and if not, I'm going to ring the crisis team. I'm in a crisis. Now I understand. I used to think, what are they doing? They're making it look harder than it is, but I'm actually struggling to get the cap back on. So don't try this at home, guys. If you've got a cap on the end of it, right, I've got it on. So now that's going to be fully protected, just in case people who are having home IV therapy, or, well, in most cases, it's home IV therapy, antibiotic. Now they could be doing stupid stuff that they shouldn't be. They could be popping out inside the garden, and now this is a risk of infection. What we have round here is I used to call it a bandage. What is the name of this now? It's not a bandage, a dressing. So what I have to do, because I've got an airy chest, I have to shave it, and it gets shaved so this dressing can stick on the chest. And then I've got a piece of plastic that's inserted inside my chest, and this needle is quite a large needle. It doesn't look large because it's embedded in the portacath in my chest. So it's, say it's about something like that, a couple of inches, you know what I mean? So it used to hurt when they used to insert it, and my partner said to me, after a bit you'll get used to it. It's because it's fresh. So basically it's had trauma. It's a big operation really. They make out it's not a big operation, but they have to cut. You can imagine they have to do a pretty big incision like that. They have to insert a plastic device that sits in your chest, and you have to have a line inside your neck. Don't know if you can see it around the dura. So it's a line to the neck, and then there's a line to the lungs and the heart. So basically, instead of having a cannula in your arm, this is going straight into where it needs to go very quickly. So it's going to be getting in the bloodstream quicker. It's going to be getting into the heart, the lungs, that kind of thing. And they can actually take bloods from this if it's working. Also, less risk of, say for instance, this come out at night time, I wouldn't bleed to death, where I had a cannula in my arm, and it come out on its own. I wasn't doing anything. The cannula come out, and I started sort of bleeding out. Now I did speak to one of the nurses. I said, "Can you potentially die like this?" And they said no, because what would happen, the blood would start clotting, and then the line would get clotted, and the blood would stop. But I'm not chancing that. I said I will not chance it again. I said if this this gets any damage to it or they can't access it, then they either put a central line in the arm, which I used to have, a central line, midline, or they try and get the port operating again, because that was quite scary, to be honest. So hello there, mate, thanks. So this is just your line, guys, yeah. Like I said, it used to be shorter. So what you would have, you'd have a nurse right in your face trying to access the line. So they made it a bit longer, and I guess they could only go a certain length with it, because the longer it is, it's got more chance of being pulled out. I do worry sometimes that it might get caught in the neck, in the chain. But this chain my mother gave me, it's a pretty short chain. I'm hoping to get a bit of a longer one, so that I don't run the risk of choking at night. But yeah, it's alright. It's got a clamp on it, so it gets clamped when it's finished. And that's it, really, guys. So yeah, I'm on day 2 of IV meropenem, which is a strong antibiotic. Felt a bit tired today, not gonna lie. I've stocked up on a load of crappy food today. I had a Greg's breakfast, which was a sausage baguette. I bought the concentrated orange juice from Greg's, and it tasted like cat piss. I mean, I've tasted some from concentrate, from concentrate. Well, I can't say the word. You know what I mean? Orange juices, and they're not the best. But this one, I don't know what it tastes. It tastes between a smell of cat piss and poison. Then for my dinner, I had McDonald's. I had McDonald's, and I didn't stop there. Later on that night, my brother said to me, "Do you fancy a chicken kebab?" I put about 2 stone on. Yeah, so yeah, I've not really been doing much, to be honest. I've not gone out during this treatment, because it does really drain you. I've started noticing I've got a right size side wheeze. Been doing my nebulizers, things like that. But yeah, I think I'm picking up. I think they caught the infection at the right time. But this time the idiots didn't take a sputum sample. People who don't know what a sputum sample is, it's just a sample where you bring your phlegm, your mucus, and you put it in like a urine sample, and it gets sent off to the lab. Well, they didn't do this, so all they can go off is my bloods. So say for instance they come back tomorrow and say to me, I need a sample, I'm absolutely refusing it, because if I give them a sample now, the 2-day antibiotic I've had in my body could mask anything. So I'm just going to say, no, go off the bloods, go off my blood work, and we'll leave it there. So yeah, that's it really, guys. So anyway, we've had 2 new subscribers, so thank you for subscribing. If anyone comes to the channel and they want to talk about lung disease or ask me any questions, I don't mind that. Sometimes I get random people on here. We talk about anything and everything within reason. Sometimes we talk about gaming. Some people like playing consoles, some people like the football, some people like news at 10, you know what I mean? But I only stay on for about 10-20 minutes at the most. I just think you can say what you need to say in 10 to 20 minutes. And then it's just like a kind of thing where I'm updating everybody, and it's been a while since I've updated people on treatment, so I thought I'd do it. If there was anything exciting like showing me medications, I would, but there's nothing really to show. It's all downstairs, so the nurses come in, they speak to me, and then they go and make the medicines, and some of them are fast and some of them are slow. Sometimes people will come in, do the medications, they're gone within half an hour. Sometimes they're there for an hour. The longest parts is the comprehensive. You have to do like a comprehensive at the beginning, how you're feeling, what you can and can't do, have you got any restrictions, has your tablets changed, all this nonsense. Obviously take the bloods before the treatment starts, and then they do all that again going into your 2nd week, and then normally it's plain sailing. Then you're probably on about you're on day 7, day 8, so you've got a week left. But it is long-winded. It's not the best thing to have. I mean, we have it at the comfort of our home, yeah, but it makes you very housebound, because the time gaps between each dose, they're a couple of hours here and there, so you don't really get a time frame for when you get your antibiotics. It's anywhere from 8 a.m. till 11, alright? And then the window is normally 6 hours, so sometimes 4:30 till 10 o'clock at night. And yeah, so it's a waiting game really. You don't normally, sometimes they'll ask you like what time you're having tea, and you could tell them, and sometimes, you know, it runs like clockwork and they turn up when they say they do. Sometimes an emergency might happen. Someone might change shifts or something, someone might go home sick, so sometimes you do get them coming very late. And so your treatment, even though you're having it at home, it's not always plain sailing. Like I say, we rely on takeaways a lot, things like that. Not feeling well, medicines drain you out, drain you. We have a lot of sleep because of the infection. The antibiotics is a very strong one. But I've done okay this time. I don't think I've had a nap. But day 3, that's when you really feel the medication, and you feel dehydrated as well. So the key is to drink a lot of water. And sometimes if you don't, what happens is your blood pressure drops, and then you get told off by the nurses because they're like, your saturations were good a few days ago, now they're dropping, and they won't leave the house until you've chugged a bottle of water, and then they'll check it either manually, or check the heart rate manually, and then do the blood pressure again, that kind of thing. But yeah, is what it is, isn't it, kiddies? Is what it is. I'm not ignoring no one. Hi there, mate. Even, hi. Welcome to the channel if you're still here. So yeah, someone said I'm on steroids. No, mate, just got a good diet. I just think with age, I don't really do many steps. Today I've done 708. That was to me. That was to me refrigerator in my toilet. No, I just think some people, as they age, they put weight on, and others do the opposite. So they might have been big when they were a child, teenager, and then they go on a little bit of a strict diet and they stay slim. But I'm the reverse. I was about, like I say, about 8-9 stone when I was 21, and close to about, I think I've lost weight, to be honest. The biggest I've been is about 82 kg, and now I think I'm 77.6, but I'm only short, you know what I mean? So yeah, I'm gonna look bigger than most people because I'm quite small, compact, stocker. So, you know, you probably think I'm about 15-16 stone. Anyway, guys, I'm going to shoot off because I'm rambling some gibberish. So before we go, kiss the cross, because the cross isn't just for wearing. So what I've been doing, anytime I'm having a insecure moment, feeling down, or just before bed, before I pray, if you do, you know, follow Jesus Christ, I suggest we look at our tattoos that we've got, our crosses, and not just wear them as a medal of honor, but actually respect that we are carrying the cross with us, and just, you know, like I say, give it a kiss. Give it a kiss from me. Right, I'm going, guys. Love yous, leave yous. Ciao.